innovation that will give us the jobs of the future so that America can continue to lead the world. I think America deserves nothing less, and I intend to continue to fight for that type of vision for America. And with that, Mr. President, I notice an absence of a quorum.
Clerk will call the roll.
Mr. Akaka. votes that will occur tomorrow. One, well, there'll be three. One, the passing of the continuing resolution, which I reluctantly support because of the many cuts in it, but also the two riders, one defunding the health care bill and the other defunding Planned Parenthood. My gosh, how outrageous that we have to vote on these two riders. These two riders do not absolutely affect our deficit and our debt. And in fact, the health care reform that we passed by the CBO-owned estimates and by independent evaluators say that we will actually reduce health care costs because of what we've done. But, Mr. President, what I want to talk about is the consequences of what they're talking about. The right wing is trying to change the conversation away from how do we create jobs in this country, how do we authentically reduce deficit and debt, into socially provocative riders that literally wage war against women. Now, the extreme wing campaigned against the health care. They said they were going to repeal and replace. All they want to do is repeal. They have no idea for replacing. But let's talk about what they want to repeal. Let's talk about the war they're waging against women. If you repeal or defund health care, it will have draconian impact on American women. Make no mistake about it. In the health care bill, we ended gender discrimination in health insurance. No longer could insurance companies charge 30 to 40% more than men for the same coverage of equal age and health status. The other thing that we ended was denying women health care on the basis of a pre-existing condition. We were horrified to learn that in 8 states, women were denied health care insurance access, simply because they were a victim of domestic violence. They were beaten up in their home, they were beaten up by insurance companies, and now they want to beat them up on the Senate floor and beat them up in the Senate budget. Well, we're going to stand up. We're not going to tolerate women being pushed around and made targets of this war. And no longer can women be denied coverage because they had a C-section or because they had a premature baby. Then we fought for preventive services. We fought for mammograms and pap smears, but we fought not only for ourselves, we fought for men too, which included their screening. If you defund health care, make no mistake, and every woman in America should know, they're going to take the funding for mammograms away from you. They're going to take away the Preventive Health Amendment that allowed you access for preventive screening at no additional copays or deductibles. Do we really want that? Oh, sure. You're going to be able to have your mammogram, but you're going to dig deep in your pocket. So then we also fought the fact that so we wanted to end gender discrimination. We wanted to end the punitive practices of insurance companies towards women on the basis of pre-existing conditions. And we also wanted to have preventive care. And one of the greatest preventive care giving agencies is Planned Parenthood. It is one of the single most important health care providers to particularly young women in America. 8,000 Maryland women. If we lose Planned Parenthood, we're going to lose 8,000 Maryland women will lose pap smears. 7,500 women will lose access to breast care exams. Many of them will lose actually access to health care generally. Now, just because the Republicans live in the dark ages doesn't mean American women want to go back to them. That's why we, the Senate Democratic women, will be voting against these two riders. Women must be clear, defending this amendment or a way to end the war against women. There will be many fights ahead of us. We are under attack. We women are under attack at all ages. The Paul Ryan budget particularly attacks senior women. We're going to fight this. We're suited up. We've squared our shoulders. We put our lipstick on. And, Mr. President, this is not about gender. This is about an American agenda. And we will fight, and we will make our fight a victory. Mr. President, I yield the floor.
Mr. President.
Senator from Washington is recognized.
Mr. President, I want to thank all of my Democratic women colleagues for coming today and speaking so passionately, as Senator from Maryland has just done, about an issue we care deeply about. You'll be hearing from all of us, because we are outrageous that the price tag for a vote on the continuing resolution is to attack votes on women's health. And I yield to the Senator from California for 5 minutes.
I want to thank, Mr. President, Senators Mikulski and Murray, Senator Cantwell and Shaheen and Stabenow and Landrieu. I'm going to really name every single Democratic woman. They have been unbelievable. And since the beginning of this budget battle, our Republican friends in the House have insisted that this debate is about spending. Well, I got to tell you, we went all the way to them, about 70% plus on spending cuts. We understand we have to cut, but we're not going to cut foolishly. We're not going to cut into the heart and soul of our country, and that includes women's health programs. Women's health programs, Mr. President. Title X, Planned Parenthood funding. For every dollar of taxpayer funds, they yield $4. That's how great the prevention is. And yet, and still, what do they want to do? You see these two riders, these two votes we have to have, until they would allow us to have a vote on keeping the government open, they pounded the table and said we have to have two riders. What was it? Was it some big budgetary item that maybe we overlooked? Was it some move that would say to the taxpayers that aren't paying their taxes due, like some of the big corporate giants that hire enough lawyers they don't pay? No, it wasn't about that. Was it about some scandal that they uncovered that they said could save us money? No. The two votes they want are about giving the shaft to women. Women and their families. The two votes are about health care, which primarily impact women, and by the way, also men, but primarily impact women. So if that's the kind of budget war they're engaged in, they have met us on the battlefield. And we have decided that we will remain on that battlefield, which is this Senate floor, as long as we have to. We will go to the galleries of the press as long as we have to. We'll fight it in our states. We'll fight it in our cities. We'll fight it in our counties. We will fight it. And we believe at the end of the day, the people will see who's fighting for them. Who's fighting for them? Now, I'm going to just read a couple of letters from my state. My state is the largest state in the union, and Planned Parenthood provides care for 750,000 women. Listen to this woman. Planned Parenthood is the only health care I've ever used, ever, she says. I don't have health insurance, so when I get sick, I get over it as soon as possible so I can go back to work. Planned Parenthood has provided me with the only health care coverage I can afford. Pelvic exams, STD testing, birth control. It isn't much, she writes, but can you imagine the millions of people who rely on Planned Parenthood suddenly living their lives without these basic services? And she answers her own question. It's shameful. It's shameful. And that's a letter from Sonia Kodemar. I have other letters, Mr. President. Letters from women in my great state. 3 million Americans get care at Planned Parenthood. 3/4 of them have incomes below 150% of the federal poverty level. They rely on Planned Parenthood, more than half of them do, as their only health care. And by the way, the other rider that we have to vote on is to defund health care. My colleagues have said it. Senator Mikulski, who worked night and day with the late and great and extraordinary Ted Kennedy, to get us to the point where finally we were telling the insurance companies, no, 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 no. You can't charge women 3, 4, 5 times more for the same coverage as a man. And by the way, being a woman is not a pre-existing condition, and if you've had a cesarean, you can't deny that woman who had a cesarean health care coverage. And if you're a victim of domestic violence, that is not a pre-existing condition. That is what we repaired in the bill, in addition to many other things that we did. They want to give the shaft to women and their families, and we're not going to stand for it. Barbara Haya from Oakland wrote to me. She said she was a student. When she was a student with limited funds, she was denied health insurance because of a pre-existing condition. Planned Parenthood was Barbara's only source of basic health care. And when she needed cancer screenings, Planned Parenthood was there. And she says, please, please don't cut any funding to Planned Parenthood, because without them, she wouldn't have her health care. So let's be clear. Nationwide, 97% of the services Planned Parenthood provides have nothing to do with abortion. They do not use a dime. It is illegal. It has never happened. For that 3%, that's private funding. So don't stand up and say this is about abortion. It has nothing to do with it. As a matter of fact, if they have their way, and this is a fact, Mr. President, and women don't get birth control, we will see more unintended pregnancies. We will see more abortions. That's just the fact. So anyone who votes to defund Planned Parenthood, A, they're denying essential health care services to women and their families, and B, their policy will lead to more unintended pregnancies and more abortions. So yes, we stand here strong. And maybe some of us are 5 feet or under even in a couple of the cases. But that belies our determination and our strength. And we stand here united. And we say to the people of this country, you can count on us, because we will be here as long as it takes to protect women and their families, and we will not allow women and their families to be held hostage. It's over. It's over. Thank you very, very much, and thank Senator Murray, Senator Mikulski, and I yield the floor.
Mr. President.
Senator from Washington.
I want to thank my colleague from California for her great statement, Senator from Maryland, and you will hear more of us because, frankly, Mr. President, we are here today because we are outraged. We strongly oppose the resolutions on the floor that slash health care for women and girls and middle-class families. And I have to say, as a woman and as a mother, I am really angry that women's health care is even up for debate right now. Middle-class families in this country are struggling. When I go home to my home state of Washington, I hear about people who are worried about getting a pink slip or how they're going to put food on the table, whether their job's going to be there for them, and if we are making sure our economy is working for them and their children. That's what I hear about. I do not hear about when are you going to slash health care for women. Not once. Mr. President, we have seen a smokescreen, and that's why we're here. Last week, under the continuing resolution that was being negotiated between the House and the Senate and the White House, one remaining open item: eliminating Title X funding for women's health care. It wasn't about budget deficits. It wasn't about the debt. It wasn't about jobs or the economy. It was about an ideological-driven attack on women's health care. We were able to keep that out of the continuing resolution that we will vote on tomorrow. But the price tag that the Republicans in the House gave us to get to a vote to keep government open and to move our country forward is 2 votes, one that defunds Planned Parenthood and one that defunds health care. Both of those are extreme attacks on women's health care. My colleagues have spoken eloquently about Planned Parenthood. This is not about abortion. Federal funds cannot go to abortions. We're frankly tired of having to correct the untruths that continually come out about this funding. But we're not going to give up, and we're going to keep fighting, and we're going to keep correcting them. Planned Parenthood is about providing federal funds for care like mammograms and cervical cancer screenings and prenatal care and family support and counseling. Mr. President, this is about preventive health care services for women, and we take it as a direct attack on every woman in this country and her ability to get the health care that she needs. And the second vote is an attack to dismantle health care. Well, let's remind all of us why health care finally became an issue that we were strong enough to deal with in this country. I'll tell you why. Because women finally said we've had enough. Let's face it, women are the ones who take their kids to the doctor, they're the ones who see the bills coming in, and they're the ones who fight insurance companies on a daily basis, and they said we've had enough. So we went through a long process here to make sure that we passed health care in a way that protected women. It was women who were denied health care coverage because of pre-existing conditions time and time again. We said no more. Now they want to vote tomorrow to put that back into effect. We heard from women who were denied coverage for health care because they were a victim of domestic violence. We said no more, and now they attack that again. Mr. President, there are so many reasons why this is the wrong approach, but I will let all of our colleagues know. We're going to defeat these amendments tomorrow. We're going to move on, but the Democratic women of the Senate are now vigilant, and we are here, and we are not going to allow the 2012 budget or further discussions as we go along be a smokescreen to cover up a real agenda, which is to take away the access for health care and the basic rights that women have worked long and hard and fought for in this country. So thank you, Mr. President, and I want you to know you'll be hearing more from us, but we're not going away. We're going to defeat these amendments tomorrow, and we are here to fight them until they stop being offered. Thank you, Mr. President. I yield the floor to my colleague from Michigan.
Senator from Michigan.
Thank you, Mr. President. It's my great pleasure and honor to be here with my friends and colleagues who have all fought so long and hard to make sure that women's voices and experiences are represented in the decisions that we make here in the United States Senate and in Washington on behalf of all the families that we represent. I have to say that people in Michigan, my family, friends, everybody across Michigan is shaking their head right now trying to figure out what the heck is going on. All of this really is a diversion from what we want to be talking about and doing something about, and that's jobs, putting people back to work, making sure people have money in their pocket to be able to pay their bills and that they can tackle their house, who that very well may be underwater right now, and how they're going to pay for gas prices going through the roof, and how they're going to be able to take care of their kids and make sure that they can have the opportunities to go to college that they want for them. All the things that we all want for our families, that's what families want us to be talking about right now. And I also have to say that the people in my state are finding that the dollars that they earn right now are hard to come by. These dollars are precious, and we need to be holding every program accountable. We need to get results for every dollar they send and make decisions. If something doesn't work, we need to stop doing it, and we need to focus on things that do. And we know that the whole deficit discussion is very critical for us, and that we need to be smart about the way we do things. That's really not what this debate is about at the moment, certainly not on women's health care, but we understand that we need to be serious about this. And certainly in my role as chairing the Agriculture, Nutrition, and Forestry Committee, we take that very seriously, and we'll be doing that in the context of our responsibilities moving forward. But I also know, and the people in Michigan understand more than I think anybody else across the country, that we'll never get out of debt with more than 15 million people out of work, which is why we want to focus on jobs. They also know that women of all ages, seniors, middle-class families, didn't cause the deficit hole that we're in. And they should not be responsible for the sacrifice and burdens on their backs only in order to move us out of deficit. And we certainly are not going to allow a thinly veiled threat to women in general to become part of a debate about health, about how we balance the budget and eliminate the deficit, which is a very real issue. The fact of the matter is that in order to get the budget completed for this year, women's health care was held hostage. Now, we were able to separate that because the women came together in the Senate and said there's no way that we are going to allow this whole debate to become some political debate about whether or not women should get breast cancer screenings or cervical cancer screenings or blood pressure checks. And so we've separated that now from the agreement for the rest of the year, and I'm proud to have stood with women from all over this country to say, no, we're not going to let you play politics with the women of this country in our health care. But now we have in front of us two different votes. This was the price we had to pay, and we're willing to stand here and make the case for why why people need to vote no. But it's also deeply concerning that we have to be in a situation to debate whether or not women should get breast cancer screenings and cervical cancer screenings, and whether or not we should have access to health care as a part of the price to be able to come together on a budget agreement. And that's exactly where we are. You know, in 2009, we had women from all over Michigan. We have the majority of the funds for what's called Title IX for preventative care goes to health departments, by the way. I helped be able to support, when I was a county commissioner years ago, the Ingham County Health Department setting up their preventative care center for women, health care screenings for women, and all across Michigan. 70% of the funds under something called Title X go to health departments. There is a small amount of that that goes to Planned Parenthood, and that's being very, very politicized now because of the other side's wish to politicize women's health care. But in 2009, those centers provided 55,000 cancer screenings, and we had almost 4,000 women, 3,800 women, who got back an abnormal result on a cancer screening. Because they had a chance to get that screening, they then had the opportunity to do something about it, and lives were saved. Moms are alive today to be able to care for their children and watch them grow up because they found out they had breast cancer early. Grandmas are alive and well today to be able to play with their grandkids and their great-grandkids because they found out early they had breast cancer or cervical cancer or some other health care challenge. I think we ought to celebrate that as the best of who we are and our values in this country. The other piece that we have in front of us will be to defund health care in general. And we know, first of all, that women are health care consumers, usually in families, making the decisions about health insurance, if you are able to have health insurance, or how to purchase it, or what will be covered, and certainly caring about our families. And we usually are the last ones to take care of ourselves, and I certainly can speak to that myself, as maybe other colleagues can, that we tend to make the decisions first for our children, our families, and not take care of ourselves as we should. But we made a very strong statement, and I think a value statement in health care reform, to say that we want to make sure that women have access to health care and that they can afford to get it, and that they're not penalized, we're not penalized as women, and that we're not going to have to pay more. Right now, prior to health care reform, any woman purchasing health insurance on her own was paying more, sometimes up to 50% more or more, for the same health insurance as a man, or even less health insurance. because she was a woman, because she may be of childbearing years, because of whatever the reason. Women have traditionally paid more for the same insurance. That's no longer the case. Now, for the same coverage, the same medical circumstances, women cannot be discriminated against. That's a good thing. I think that's something we should be proud of, that we've been able to do to make sure insurance companies cannot charge women more just because they're women. We've also made clear that preventative care is an essential part of basic health care. And I will always remember the debate that I had as a member of the Finance Committee with a colleague on the other side of the aisle over whether or not maternity care is a basic part of health insurance and health care. Of course, I think it's hard for people in Michigan to understand why we'd even have to have that debate, because prenatal care, maternity care certainly is a basic, not just for the woman involved, but for the baby, for the family. But we stood together and we said we're going to make sure that maternity care is part of the definition of basic health care. So there were a number of things that we did together, the women of the Senate, to make sure that over half the population, the women of this country, have access to quality, affordable health care for themselves so they can continue to care for their families and be a very important part of who we are in contributing to America. We're here because tomorrow the question will be, should women's preventative health care services be allowed to continue as part of our framework in terms of health care funding, both broadly in health care reform and narrowly under Title X and family planning for the country. We will say no to the efforts to defund women's health care. I hope going forward, as we tackle huge issues for the country around bringing down the debt and balancing the budget and growing the economy and creating jobs and looking to the future, that we will not see, once again, something as important as women's health care put on the chopping block as part of the debate. That's really the message that all of us have and the message that we will be sending tomorrow, that women across the country need to know that they are valued, that we want them to be healthy, we want them to be able to afford to find health insurance, we want them to be able to get those cancer screenings, and that we value their lives, and that we don't believe folks should continue to play politics with their health care. Thank you, Mr. President.
Senator from New Hampshire.
Thank you, Mr. President, and I want to thank Senators Murray and Mikulski for gathering us here today, and all of my colleagues who are here. I'm proud to be able to join them. Tomorrow, we're expected to be voting on House proposals to defund Planned Parenthood and the Affordable Care Act. These resolutions have been offered not because anyone argues that they create jobs or improve health care, but because House Republicans were willing to shut down the federal government if they did not receive a vote on Planned Parenthood and health care. So that's right. Even though shutting down the government would have meant furloughing 800,000 people, including members of the military, they were willing to shut down the government. This kind of a threat, especially in a recession, is irresponsible. Planned Parenthood is a critical provider of women's health care, especially to low-income individuals. 1.4 million Medicaid patients around the country, mostly women, but not all women, depend on Planned Parenthood as their main source of primary and preventive health care. They depend on Planned Parenthood for contraceptives, for screenings for sexually transmitted diseases, and for screenings for breast and cervical cancer. In some parts of my home state of New Hampshire, Planned Parenthood is the only provider of preventive services for low-income women. It serves almost 16,000 patients annually. In a time of economic hardship, we should not be taking steps to reduce access to health care. And let's be clear, this vote has nothing to do with abortion. By law, Planned Parenthood cannot, that is, cannot, use federal funds for abortions. Moreover, Planned Parenthood provides family planning services that greatly reduce the occurrence of unplanned pregnancies. It's ironic that many of the most ardent opponents of abortion are the very people who want to shut down the family planning services that prevent unplanned pregnancies. So this vote is also not about deficit reduction. Despite what some of members of the Senate have claimed, 97% of the reproductive health services provided by Planned Parenthood in New Hampshire and throughout most of the country are preventive care. Over 90% are for preventive care. And as we all know, preventive health care lowers health care costs and it saves lives. Detecting cancer early through regular screenings greatly increases a patient's quality of life and her chances of survival. And in the long run, it's vastly cheaper for patients in the health care system and the federal government for diseases to be prevented or treated early. One of my constituents from Rochester, a mother of two, told me about her oldest daughter who works for a small restaurant. Her daughter can't afford health insurance, and it's not provided through where she works. So for her regular checkups and preventive care, she relies on Planned Parenthood. Now, because of a history of cervical cancer in her family, her daughter was regularly screened. And it was Planned Parenthood that first diagnosed her daughter with cervical cancer. And because of that early diagnosis, her daughter was able to obtain successful, life-saving treatment. There are countless stories like this. We heard some of them on the floor this afternoon. Mr. President, I also want to address the other House proposal that we've been talking about this afternoon. It's a proposal that would also hurt women's health care, and that's the pending resolution to deny funding for health care reform. Already, the Affordable Care Act is working for women across the country. As of last year, it's illegal for insurance companies to require women to obtain pre-authorizations or referrals to access OB/GYN care. But there's a lot of work that still has to be done. Currently, women in the individual health care market pay up to 48% more in premiums than men. And beginning in 2014, this kind of discrimination, because of the new health care law, will be outlawed. Issuers will be banned from issuing discriminatory gender ratings to charge women and small businesses with predominantly female workforces more for the same coverage. In the same year, 2014, health care reform also makes it illegal for insurers to deny health care coverage on the basis of pre-existing conditions, designations which have often been used to discriminate against women. Many women across the country today are denied coverage for pre-existing conditions such as breast or cervical cancer, having had a C-section, or even just being pregnant. Some women have even been denied coverage for having sought out medical care for domestic or sexual violence. It's critical that we ensure low-income women have access to health care in these difficult times, and that we ensure that all women have access to health care. So I urge my colleagues to vote against these two provisions tomorrow, these ideological attacks on women's health care. Let's get back to the business of creating jobs and dealing with this country's debt and deficit. Thank you very much, Mr. President.
Senator from Washington is recognized.
Mr. President, I join my colleagues to come to the floor this afternoon and talk about tomorrow's votes on two different amendments, and to say that I'm proud to join my female Senate Democratic colleagues in this effort and to speak out about this important issue. To me, the American people have sent us a clear message. They want us to focus on job creation, on promoting innovation, and putting Americans back to work. But instead, tomorrow we'll be on the Senate floor trying to defend access to health care for women. We'll vote tomorrow on whether to defund Planned Parenthood, an agency that serves hundreds of thousands of people in my state on important exams such as breast examination and helping to prevent infections and various things. And just a few weeks ago, I talked about one of our constituents, a 22-year-old woman from Seattle, who was diagnosed with an abnormal growth on her cervix at Planned Parenthood and was able to receive life-saving treatment. She was uninsured, and without Planned Parenthood, she would have not been able to get that kind of treatment, and certainly her health would have been in major danger in the future. I tell her story to emphasize the importance of Planned Parenthood on prevention, and that they are centers of prevention for many, many women who have no other access to health care. And so we cannot jeopardize the access to that preventive health care at a time when it's so important for us to reduce long-term costs. In fact, even in the investment area, every dollar invested in family planning and publicly funded family planning clinics saves about $4.2 in Medicaid-related costs alone. So prevention of health care is good for us in saving dollars, and it's certainly good for our individual constituents who have a lack of access to health care. That's why I'm so disappointed, and the situation that we're having now where our colleagues are saying to us, you can get a budget deal, but you have to defund women's health care access to do so. The avoidance of a government shutdown has also brought on, I think, a challenge on the backs of women in the District of Columbia, because it included a provision denying D.C. leaders the option of using locally raised funds to provide abortion services to low-income women. For those who argue against big government, this is a contradiction, because this is a real imposition on the ability of elected officials in the District of Columbia to decide what to do with their locally raised funds. I know, because I'm in the Hart Building, what the mayor and others on the council had to say about this. This is an imposition on the health services of low-income women in the District of Columbia, and certainly has gone almost unnoticed in the 11th hour, and I think sets a precedent for a dangerous, slippery slope with what we are telling local governments to do. But, Mr. President, it is time for us to focus on our budget, living within our means, and getting back to work, but certainly not to try to do all of that on the backs of women. And it is not time to shut down access to women's health care. Republicans in the House have decided to wage war and to say women should be a bargaining chip. Well, I think the American people have sent us a clear message. They want us to get back to work, and they support Planned Parenthood and the efforts of Planned Parenthood on preventive health care and health care delivery services. A recent CNN poll showed that 65% of Americans polled support continued funding of Planned Parenthood. And I know my colleagues on the other side of the aisle would like to say that these funds are used and helped in funding organizations that may be involved in doing full reproductive choice services. But I ask them to think about that issue and that logic. Where will they stop? It's Planned Parenthood today, but are they going to stop every institution in America from receiving federal dollars? It is illegal for Planned Parenthood to use federal dollars for the full reproductive choice, including abortion. It is illegal. You cannot use those funds. And yet the other side would like to say that this is an issue where they would like to stop Planned Parenthood today, and then they'll try to stop other organizations in the future. It's time to say no to this amendment tomorrow, and to say no on trying to pull back from the full health care funding bill at a time when we need to implement the reforms to keep costs down and to increase access for those who currently don't have access to health care and come back to the system with much more expensive health care needs in the future. So, Mr. President, I'm very disappointed that at the 11th hour of a budget debate that is about living within our means, about how we take the limited recovery we've had and move it forward economically, instead we are saying that we can't move forward on a budget and a recovery until we take everything that we can away from women and access to women's health care. We will fight this tomorrow, and I'm proud to be here with my colleagues to say we will be the last line of defense for women in America who are going about their busy lives right now, taking their kids to school, trying to juggle many things at home and work. And they are every day, as the budget people within their own homes, trying to figure out how to live within their means. And the national budget debate has broken to this point. We can only have a budget agreement if you defund women's full access to health care. That is wrong, Mr. President, and we will be here tomorrow to fight this battle and speak up for women. I just want to point out to my colleague who is here on the floor from New York that I remember in 1993, in the year of the woman, when so many women got elected to Congress, it was the first time in the House of Representatives we had a woman on every single committee. And the end result of that is we had an increase in funding for women's health research. So much of the research had been, up until this point, focused on men. Why? Because there wasn't anybody on the committee to speak up about how women had uniquely different health care needs and deserved to have a bigger share of funding for health care needs of women than we're currently being funded. That's what you get when you get representation, and the women senators will be here tomorrow to fight, to say that women deserve to have access to health care through Planned Parenthood and Title X. And please, for those working moms who are out there juggling, dealing with children and child care, dealing with their jobs, dealing with pay equity at work, dealing with all of these other issues that women are struggling with, that they don't have to be a pawn in the debate on the budget, that there are people who believe, just like the majority of Americans do, that we should move forward with this kind of preventive health care for women in America. I thank the President, and I yield the floor. And I see my colleague from New York, who has been a staunch supporter of Planned Parenthood and women's health care choices, and I thank her for that leadership.
Thank you. Mr. President.
Senator from New York is recognized.
Well, I want to commend my colleague for her extraordinary remarks and her leadership on fighting these issues. It's a privilege to be here in the Senate today to listen to the remarks of all of the Senate women colleagues who care so deeply about women in America and how they are literally being used as a pawn in a debate about the budget. These women have drawn a line in the sand about we will not let you cross. You may not balance the budget on the backs of women, period. It's very simple. The election last November was not about a mandate for these social issues. It was about the economy. It was about how are we going to create jobs? How do we get a body of representatives to come together, work together across party lines to come up with solutions? That is what the election was about. The American people voted overwhelmingly for a vote and a discussion of issues relating to jobs. How do we create jobs? How do we create the atmosphere and the landscape so our small businesses can grow? But that's not what the House of Representatives is focused on. No, they have created an entire agenda around an assault on women, women's safety nets, women's health care, protections for women and children, early childhood education, prenatal care, pap smears, you name it. This is what they are beginning to focus their attention on. Millions of Americans depend on reproductive services. Millions of women depend on prenatal care, on early cancer screenings, breast exams, all of the types of preventive health care that families rely on. In fact, in New York, there are over 200,000 New Yorkers that rely on this preventive care. For my friends and colleagues, this is a factual statement. Current law already prevents federal money from paying for abortions. This has been the law of the land for over 30 years. Shutting down the government to fight a political argument is not only outrageous, it is irresponsible. The price for keeping the government open is this assault on women's rights, equality, access to health care, access to preventive care. Women shoulder the worst of health care costs, including outrageous discriminatory practices that we worked so hard during health care reform to fix. The National Women's Law Center tells us that under the previous health care system, a 25-year-old woman would have to pay 45% more just to get basic health care than a male her same age. Some of the most essential services required by women for their basic health were not covered by many insurance plans, like prenatal care, pap smears or mammograms, or preventive screenings, including postpartum depression, domestic violence, and family planning. The institutionalized discrimination in our health care system is wrong, and it's a tax on women and their families. What we did in health care reform was to begin to address these issues, to make sure that the inadequacies of our current system could be addressed, safeguarding women's health and making sure that this institutional discrimination no longer exists. Yesterday was Equal Pay Day. Women all across America earn 78 cents for every dollar their male colleague earns who's doing the exact same job. Yesterday was the day it would take a woman to work all last year and this year to earn exactly what that male colleague earned. Well, who does that affect? It affects families. It affects every family in America that has a working mother who's bringing money home to pay for her children, for her family, for their well-being. So when we should be talking about the economy and issues about how do we have equal pay in this country, the Republican House is talking about how to continue this rhetoric and assault and negative effects on women and their families and what they need to protect themselves. The votes that we're going to have tomorrow to defund Planned Parenthood, to repeal health care, American women, make no mistake about it. This is an attack on you. It's an attack on every preventive health service, every safety net, everything that you care about, whether it's early childhood education, whether it's pap smears, whether it's mammograms, whether it's prenatal care when you're pregnant. That is what their efforts are all about. And you should just know that you have women of the Senate who will stand by you. We have drawn this line in the sand, and we will not allow them to cross it. We are your voice in Washington. We are your voice in Congress, and we will protect you and the basic safety nets and equality that you should expect out of the U.S. government. Since I'm the last speaker, I will suggest an absence of a quorum.
The clerk will call the roll.
Mr. Akaka.
you.